Hello, my name is Ted Mitchell, account manager with OptumRx. OptumRx is proud to partner with the Office of Retirement Services to provide the pharmacy benefit for the Michigan Public School Employees Retirement System. Our goals for today's presentation are to discuss your 2018 pharmacy benefits, spend some time talking about how we can help make your formulary work for you, how to utilize online resources, and finally, we'll discuss how you can get questions that you may have for OptumRx answered. Looking at your 2018 pharmacy benefits, let's start with how much you will pay at the pharmacy counter. You are now looking at a copay example of a 30-day fill. On the left side is an example of a preferred copayment. On the right side is an example of a non-preferred copayment. Please take note that your preferred copayment will save the most money and deliver maximum value. Your preferred copayments are 20% of the pharmacy's charged drug price, with a $10 per drug minimum and a $40 per drug maximum. Here's how those minimums and maximums work. If the cost of the drug is below the minimum, you will be responsible for the full payment. If the cost of the drug is above the minimum and 20% is below the minimum, you will pay the per drug minimum. If 20% is above the minimum, you will pay 20% up to a maximum of a $40 copay. For example, if a pharmacy is charging $1,000, 20% of $1,000 would be $200. However, you are protected financially because it is a preferred drug status with a $40 max copayment. This is delivering good value. Our non-preferred brands include twice the coinsurance, 40%. A non-preferred medication has the same $10 per drug minimum. However, there are no maximum copayments on a non-preferred drug. For example, if the pharmacy were charging $1,000 for a non-preferred drug, the coinsurance of 40% would be $400. There is no maximum in a non-preferred drug, so the copay for a non-preferred drug would be $400. On this next slide, we have a very similar comparison. Please note that this is a 90-day example as opposed to the 30-day example on the previous slide. On the left side, we have an example of a preferred copayment, and on the right side, we have an example of a non-preferred copayment. Please note that the percentage amounts remain the same at 20 for preferred and 40 for non-preferred. However, our minimums and maximums have been designed so that a 90-day fill of a preferred medication will deliver the best value. Please notice that your $25 minimum has savings built in compared to 3 individual 30-day fills. And the savings are more pronounced if your drug is hitting the maximum, showing a $20 savings over 3 individual fills of 30-day supplies. Again, please note that your non-preferred has no maximum copayment and will charge 40% with no maximum. One thing that has changed for the 2018 plan year is your annual coinsurance maximum. The annual coinsurance maximum was designed to protect you financially by limiting the amount that you pay for medications. The maximum for 2018 has been updated from $1,000 to $1,500. It's important to understand that your maximum out-of-pocket behaves differently when using preferred as compared to non-preferred drugs. Let's start with preferred. If you're using a preferred brand name or generic drug, the full amount that you pay will be applied towards your out-of-pocket maximum. And when you reach the annual coinsurance maximum of $1,500, you will then pay zero for the remainder of the calendar year. If you're filling a non-preferred drug, remember the charge is 40% of the full drug cost. However, only 20% of your payment will apply towards the out-of-pocket maximum. In addition, once you have reached the $1,500 out-of-pocket maximum, you may still be required to submit payment to fill your non-preferred drugs. Now that we've discussed your 2018 out-of-pocket costs, let's shift the conversation to how you can maximize the value of your pharmacy benefit. We will start that discussion by asking a question. Why do some medications cost more than others? Well, there are several factors that go into what you pay for prescriptions. The drug placement on the formulary, the quantity, and the pharmacy that you choose. Let's start discussing the formulary. The formulary is a list of covered drugs. Medications that are on the formulary were selected for their therapeutic effectiveness, safety, and value. The formulary is continually updated based on the latest research and clinical evidence. How much you pay for your prescription is determined by its placement on the formulary. Tier 1 is comprised of generic drugs. Generics have been on the market the longest, first as brand name products, and then, when the brand's patent has expired, as generics. Since generics have been around for a long time, their safety and efficacy has been proven, and they are value priced to save the most money. If you're not taking a generic drug, ask your doctor if one is available to treat your condition. Tier 2 preferred brand and preferred specialty brand name drugs will cost you more than generics, but there's still a good value if a generic drug is not available to treat your condition. Tier 3 and Tier 4 non-preferred brand name and non-preferred specialty drugs are simply going to cost you more money. These are what we consider non-preferred products. These drugs are covered because your plan provides you with the freedom of choice, but consider the costs and talk with your doctor if you're taking a Tier 3 or Tier 4 non-preferred drug. Odds are your doctor can prescribe a generic or a preferred brand name drug that will safely and effectively treat your condition, and at the same time save you money. The second factor that goes into what you pay at the pharmacy counter is the quantity. 30-day supplies may cost less at the point of sale, but 90-day supplies, in most cases, deliver a better value over the long term. 30-day supplies of drugs are used to treat acute and specialty conditions. For example, an infection may be quickly treated and cured with the use of a short-term antibiotic. 90-day supplies are meant to treat maintenance conditions. Maintenance medications are those drugs that you take on a regular basis to treat conditions such as high cholesterol, high blood pressure, or diabetes. Avoid wastage and save money by purchasing a 90-day supply of maintenance drugs only after you know the drug will work well for you. The third factor that goes into what you pay at the pharmacy counter is the pharmacy itself. Please note that retail pharmacy prices can vary. As members of the MIPSers plan, you pay a percentage of what the pharmacy is charging. So if Pharmacy A is charging $100 and Pharmacy B is charging $110, you will pay a percentage of either A or B's price. You will find differences in prices from pharmacy to pharmacy. Our website, OptumRx.com, can be very useful in finding the best price for your needed prescriptions. Please note that in-store programs may offer additional savings. Many pharmacies now offer cash prices that could be a better value to you than using your insurance card. Also note that Briova RX offers exclusive savings for specialty medications. Remember, beginning in 2017, Medicare members have access to preferred coinsurances exclusively through BriovaRx. And our non-Medicare members must use BriovaRx in order to receive coverage for their specialty medications. One more note about your pharmacy choices. Please remember that OptumRx Home Delivery offers an affordable, convenient way to receive your needed medications directly to your door. Studies show that members that use mail order services versus retail pharmacies have better adherence in their medications, which means that they take their medications on time and as prescribed more often than members that fill at a retail location. Our OptumRx Home Delivery offers free standard shipping, so if you're not utilizing home delivery now, please give it some consideration. OptumRx offers many online resources that can help you navigate what can sometimes seem like a complicated pharmacy benefit. Our updated website, OptumRx.com, has been optimized for your ease of use. In August of 2017, we completely revamped our new website. And on our website, you can view and print your medication history, learn more about your medications, order medications from OptumRx Home Delivery, download and print important forms and documents, including membership cards, review the formulary, and compare drug costs before you fill a prescription by using our online drug pricing tool. Our online drug pricing tool is a great way to find out if you are using the lowest cost option. You can simply search the name of a drug, see a list of alternative products that may be used to treat your condition. The Price This Drug function of OptumRx.com website allows a member to compare all of the retail pharmacy and mail order specific pricing at the same time, allowing members to make the best decisions for their pocketbooks. Remember, our website is available at OptumRx.com. Everything that we just discussed that could be accomplished on the website can also be accomplished using your smartphone, including easily sharing your prescription list with your doctor, locating a nearby pharmacy with the GPS functionality of your phone, ordering refills from home delivery. This is available for Android and iPhone by going to the App Store and searching for OptumRx. For members who may have questions about their pharmacy coverage, answers are only a few clicks or a phone call away. You can find forms, plan details, and answers to your questions on our website and our mobile applications. And as always, you can contact member services 24 hours a day, 7 days a week, 365 days a year for assistance. That number is located on the back of your pharmacy card. Thank you